Okay guys, it's Dr. Sexton again, and today for our next look at fatigue, we're going to be looking at the medical workup of potential physical causes for your fatigue. And whenever you see your doctor, it's going to depend largely on how you describe your fatigue to that doctor, so we want to be pretty precise. Questions that I'll ask my patients are, hey, whenever you wake up in the morning, do you feel that onset of fatigue, like you can't even open your eyes and you're surprised that it's even morning every morning whenever you wake up? Or is this fatigue something that comes on as you start thinking about the day's worth of work that you want to get into? Or is this fatigue something that just sets on early in the afternoon, let's say at noon, 1 o'clock, 2 o'clock, or 3 o'clock, maybe when you might like to be going home from that day of work as opposed to continuing the day until it's done? So thinking about those kinds of details, describing the fatigue as whether it is a fatigue that won't let you lift your arm, won't let you lift your leg, won't let you lift something out of bed, or is this something that won't let you open your eyes? How is this fatigue playing off? Is it just a lack of motivation that also feels tired and boy, I sure would rather go to sleep than bother with any of this baloney that I've got to deal with? Take time to look at those kinds of things because that'll help guide your doctor into taking a look at some of these potential physical causes of those kinds of things, for which he's going to do a physical exam and maybe even do some other additional testing for. So let's take a look at those kinds of things too. So he'll do the physical exam, take a look at head to toe, whatever he may need to do, but some of the things that they're going to go looking for and how they're going to find those might be of curiosity to you. So anemia is one of the things that might cause someone to feel fatigued, and so your doctor is going to look at this with a complete blood count. If you've had problems with ulcers or diverticulosis in the past, those are places in your GI system that can lose blood and can cause you to be a little bit anemic. If you're a vegetarian and don't get a source of B12, or if you've had a gastric bypass surgery, all of these are reasons that we might not be getting enough blood and might be then becoming anemic over time. Sometimes as we age, or if we've got additional problems with our kidneys from diabetes, let's say, those can make it so that we don't make enough of the hormones to make the blood that we need, and thus we're going to start feeling a little bit more fatigued or a lot more fatigued as we age with those things. So these will be things that your doctor will look at as a potential cause. Infection. I mentioned earlier that if you have a problem where your body is sapping its energy stores in order to do some other purpose, this is going to be a place where you are then losing those calories and thus losing the energy and feeling completely exhausted throughout the day while your body is using that energy to fight someone else. If you've got a problem with your thyroid gland, approximately 1 out of every 8 women has a low thyroid gland, Hashimoto's disease being the most common. But whenever you have this low thyroid, it does not give you the energy that you need to go about your basic metabolic processes, and thus you feel more fatigued. If your immune system is being used for allergies, you've got an itchy eye, itchy nose where you're sneezing all day long, or maybe even you've got some asthma where you're wheezing as a result of these allergies. Any of those kinds of things can make it so that you have lower energy and are feeling more and more fatigued. So don't ignore the fact that you may have had asthma growing up, or that you may be having symptoms of it right now, because that could be playing into that energy level you're talking about. If you have sleep apnea, snoring is one of those things that can lead to our being more and more fatigued. I tell you, my father swore up and down that he never snore, but I could hear him ever since I was 4 years old from across the house. And I don't know how that gentleman was able to stand upright for all of the years that he did, despite this snoring. It really, really does lower your energy level and makes it so that you can have a slower metabolism. So in addition to making you feel fatigued, you may be having difficulty lowering your cholesterol, getting rid of some additional weight, getting rid of diabetes. These are things that we'll definitely want to make sure and rule out whenever we look at your metabolism. Other things, if your energy is being sapped in order to fight some sort of malignancy, or if the malignancy itself is using up all of your nutrition to grow and grow and grow out of control. Now, these are the kinds of things that a doctor will really not suspect right off the bat because they're not as common as you might fear that they are. But if you've got risk factors of certain kinds of cancers, let's say a family history, or you've previously had, let's say, breast cancer, or if you're a tobacco smoker, this is going to be a reason that we might suspect cancer as a potential cause and want to do more tests for that. Let's say getting a chest x-ray if you were a smoker, or getting another mammogram. And then if you've got issues with autoimmune problems, people with psoriasis, people with rheumatoid arthritis, and various other conditions like this, periodically their immune system is going to start attacking itself, thus using your own energy to fight yourself. And so not only do you get the pain in the joints, but you also get the fatigue that drags along with it. And so these can be issues that contribute to those. You'll talk to your doctor about these potential contributors and then test to see if you have any of them from there on out. If you find out that you don't have these, then we can go on to the next step in trying to get you over what is more likely causing these things if you don't have them.